As we all know, CBO, the Congressional Budget Office, led by a director who was handpicked by the current Health and Human Services Secretary Tom Price, just issued its new report on Trump Care. The report makes clear Trump Care would be a cancer on the American healthcare system, causing costs to skyrocket, making coverage unaffordable for those with pre-existing conditions and many seniors, and kicking millions off their health insurance. Unless you're a healthy millionaire, Trump Care is a nightmare. This report ought to be the final nail in the coffin of the Republican effort to sabotage our health care system. Big trouble getting 50 votes for anything. CBO report makes clear your premiums are heading up for the next several years if Trump Care passes. 20% increases in 2018, 5% following year. Now, Republicans are crowing about premiums going down in the outer years. That's because the coverage is so bad. Of course the premiums go down, but you get almost no coverage. Cheaper insurance isn't going to help anyone if it doesn't actually cover you when you're ill. Colleagues, for joining me here today. The so-called fix, which some of the moderates in the House bought into, doesn't make pre-existing conditions any easier or any better. Think about that for a minute. Under Trump Care, if you have a pre-existing condition or you're sick, your health insurance costs could go up so high you can't afford it at all. The nonpartisan scorekeepers have spoken loudly and clearly. Trump Care means higher costs and less care for the American people. For the good of the country, Republicans in the Senate should reject this path and work with Democrats to fix our health care system instead of pulling the plug on it. Yes.
We can call this legislation whatever we want. You can call it a destroy health care bill. You could call it a tax break for the rich bill, but we should not call it a health care bill, because I have never seen a health care bill which throws 23 million Americans off of health insurance. That's not a health care bill. It's not a health care bill when you cut Medicaid by $800 billion, denying health insurance to children or some of the poorest people in this country